I'm in Greenville now, tackling your questions with Dr. Cedrek McFadden, our 7 News medical expert. We're getting a lot of questions on the 7 News Facebook page. We're going to start off with Betty, who is asking, I'm high risk for getting this virus. I'm on oxygen, she says. She has heart problems, asthma, other things. She hasn't been out of the house in 8 weeks. When will it be safe for her to be around people again? Family members bringing her stuff. She gets it off the porch. But when can she get around people again?
Great question, and a really hard question to give a direct answer to. I think that's going to be based on the regions. Different cities, different states are going to have different approaches about when that time's going to be. And for people that are high risk, that also may have some influence because they may even have a more prolonged reentry into what normal life may be. So not a direct answer to that, but again, that's going to take some time, and we'll see as we get more data and see some of those numbers that come in with testing.
And maybe is it something that we should check with our own doctor about, like to, get their gauge on, they know your vulnerabilities, they may know what your best situation might be?
Especially as we talk about when is it safe to re-enter into spaces with our family or with our friends or back into the community. Yes.
All right, we have Terry asking, why does Greenville seem to be a hot spot in the state? Mentioned Spartanburg also having a lot of cases unfolding. What's the situation for why some of these larger communities are seeing a lot of numbers?
So not a one-size-fits-all answer to this, and there are many, many, many different factors that go into this. Some of the factors that come up are density. How close or how clustered together are people? That's why cities like New York are having such a tough time, because it's such a densely populated area. But the other factors that come up is, what are the ages in that population? What are the other health challenges that those people may have, whether it's diabetes, whether it's smoking, whether it's heart disease? All of that goes into effect of how people respond to this particular type of infection, but not one single answer for that.
Lucinda saying, I miss my 7-year-old granddaughter. She says her mother is working at home, otherwise she would be here with me. I want to spend time with her. I'm 67. Any suggestions? I'm really anxious about all this.
So first, let me congratulate you for doing the right thing and by keeping that social distance, but it is hard. One of the great things about this whole process is seeing how creative everyone's being, from social media to pen pals to finding ways in which you can celebrate birthdays remotely. This is when we really have to go into that creativity bucket and look for ways, whether you're visiting just outside the house and waving and leaving gifts, or whether or not you're spending time on telephone calls each day, reading bedtime stories together, or just being creative about the ways in which you can spend time with them.
We have a message or a question from Denise. She's saying, can the sun in your vehicle kill the virus?
So scientists have looked at this, and they've seen that heat, sunlight, and humidity can help deactivate or kill the virus. But the World Health Organization is very clear to say sunlight does not prevent you from getting the coronavirus, and so that should not be used as a tool to try to prevent yourself from getting this particular virus.
Dr. Cedrek McFadden, always appreciate you answering our viewers' questions.
Thank you.
Thank you.